Thanks very much, Cancora. Minister, against the backdrop of the overruns in the Children's Hospital, can I ask, there's obviously considerable concern about the provision of a cardio-catheterisation laboratory facility at Sligo University Hospital. There's a review going on now for over a year. There's obviously concern about the provision of it and indeed other capital projects in the region as a result of this cost overrun. And can I ask if the Minister can outline a timeline for when this will be provided, particularly against the superior influence, it seems, that Minister Halligan has over Deputy McLaughlin from your own party in terms of the provision of a second cath lab in Waterford while we still wait for one in Sligo.
And has plenty of influence within my party structures and within the government structures, but I thank Deputy MacSharry for the question. The government is committed to ensuring that all citizens have access to safe, high quality and evidence-based care in line with international norms. Sligo University Hospital, which I had the pleasure of visiting recently, provides high quality healthcare to the people of Sligo, Leitrim, South Donegal and West Cavan. There are currently 2 cath labs based in Galway which service the acute cardiac cases for Sligo and the North West, but also for elective cases there is a mobile cath lab unit operating 2 days per week in Sligo. It is important to note that specialist cardiac catheterisation lab services are provided in a small number of hospitals in order to ensure that the services provided achieve the required standards of safety, quality and sustainability in the interests of patients. I want to check whether there's a fair distribution of these throughout the country, because I've heard the concerns from yourself, Deputy MacSharry, and others in relation to how these are located across the country. For that reason, I established the National Review of Specialist Cardiac Services. This is ongoing and it's expected that its work will be completed in June of this year. The aim of this review is to achieve the optimal patient outcomes at population level, identifying where we should have these cardiac cath labs and to have an optimal configuration of our national adult cardiac service. As set out in the National Development Plan, investment in such labs and other cardiac services nationally will be informed by the outcome of the National Review. This is something that was sought by deputies on all sides of the House. It will provide us with the detailed information we need by June of this year, and I'll certainly act on that then, Deputy.
Mr. Deputy.
Thanks, Minister. Unfortunately, the facts don't bear out what you're saying. I mean, is the review that was commissioned and started in January 2018, has it been prepared in Aramaic or hieroglyphics or some ancient text or form of writing? I mean, it doesn't take a year, and increasingly ministers, and I don't mean any personal disrespect by this, are becoming commentators here. And very expensive commentators on 190,000 a year, saying, well, this review has taken place. I mean, a 5-year-old child looking at the map could tell you this gaping wound up here with no cath lab and 2 down in Waterford, and before anybody from Waterford attacks me for saying they're not entitled to them, I'm not saying they're not. I'm saying it is clear what sort of review is required. I mean, clearly it's just a tactic to say, yeah, well, look, that's under review. When did the last meeting of the review group take place? When did the reporting? How much is it costing? I mean, Minister, we've got to tell the truth to the people in the North West.
Your final reply.
We do have to tell the truth, but I wouldn't have a 5-year-old deciding where to locate our specialist cardiac services. Well, maybe we should, but I'd like to have doctors decide that. The Nationalist Review of Specialist Cardiac Services is independently chaired. It's chaired by the very eminent Professor Philip Nolan, President of Maynooth University. He is an independent chair. The aim of the National Review is to achieve optimal patient outcomes at population levels. The scope of the National Review is broad and was indeed welcomed by many of your party's representatives because I think it's badly needed. It will examine services for adults that address elective, urgent and emergency need for hospital-based diagnosis and treatment of cardiac disease, including diagnostic and interventional cardiac procedures and associated interdependent services. There's 15 members on the steering committee. You'll be pleased to know that they include healthcare professionals, patients crucially, and patient advocacy is important in relation to this, HSE and officials from my department. The review will also consider the responses gathered from public consultation, and there has been an opportunity for people, including from the North West, to input into this, and indeed I believe a number of people from your part of the country did give their views in relation to this. It will report in June recommending the best service configuration for a national adult cardiac service. I understand how sensitive and important this matter is in the North West, and that was made clear to me on my recent visit to Sligo.
Deputy MacSharry has another response.
Is this overrun in the hospital now on all of these capital projects we're told, are going to be put on hold. Not specific about which ones yet, but we're all very concerned about that. We've St Pants Hospital in Carrick-on-Shannon, the Shield in Ballyshannon, both new hospitals announced and expected and celebrated in press releases and phone calls and all of the rest of it by you and your colleagues. We have many developments due to take place at Sligo General Hospital, again on the capital side. Lots of photos, lots of calls, lots of all of that, but show us the money, show us the building. When are these things going to happen? And what we're worried about is the level of autopilot and commentary that's going on from yourselves. And again, I don't mean this personally, but that's how it looks like. I mean, we want leadership from you, Minister, and leadership from the Taoiseach. And that's show us the money and tell us the facts. And we certainly don't want the kind of autopilot that seems to be at play in the context of the Children's Hospital, which now it appears it's going to have an adverse impact on the provision of a cath lab for the people of the North West. They have none at the moment. 550 people a year at a cost of 10.6 million to the Exchequer are being shipped to Galway to have their work done. 3.6 million a year to rent this temporary truck that wheels in 2 days a week, as you mentioned. I mean, if you were to bank it, it'd be much better sense to finance one and put the people in place. Thanks.
So, it was a good effort, but there's no linkage between the National Children's Hospital and the decision to provide a cath lab in Sligo. And let me explain why. Because we'll make that decision based on the clinical advice and the report that will be given to us by the National Review Group that will report in June. I don't think that's being a commentator. I think that's asking medics and patients to come together under an independent chair and look at the best and fairest way to distribute specialist services across our country. Whilst the National Children's Hospital will take up about 20% of the health capital budget in my department, which, by the way, 25% of our population are children. 80% of the capital budget of my department will be spent on things that has nothing whatsoever to do with the National Children's Hospital as well. So there will be very significant increases in capital in health. That's very clear to see. The budget is almost 11 billion for the next 10 years compared to just 4 billion for the last 10 years. And this will enable us to invest in further in services in the North West, not just the cath lab, but the extra bed block that you also so badly need at your hospital in Sligo. So I'll keep the Deputy informed as this review comes to a conclusion this summer.